Hi, my name is Saina Attaran, and I practice at the Gilbert location of CVR.
Why did you choose vein care as your specialty?
Well, as a cardiac surgeon for over 10 years, my main priority has always been focused on patient care. After being introduced to the vein care, what captured my attention was the results, especially the immediate results that I saw in these patients after treating them, the relief from pain, discomfort, and I saw how immediately they went back to their functional lives and to their families and to their work. And that is why I really fell in love with this specialty.
Why did you choose CVR?
After substantial research, I found that CVR to be the leader in patient care with great results for the patients in our community. And also, I found that CVR to be the leader in tailoring the vein procedures based on patient's need or every individual's need. And also, another main attraction about this company was that this is a nationwide company and it offers continuity of the care. So if the patient is moved from a state to state or a town to town, they can always be cared for with same standards in another CVR location.
Can you tell me a little bit about your philosophy of patient care?
Well, my philosophy is simple. Although the procedures in phlebology are focused mainly on the lower extremity, but the overall vein diagnosis cannot be overlooked because they can be manifestation of cardiac disease, vascular disease, hematological or abdominal condition. Therefore, a patient should be looked at as a whole, and that is my main philosophy in patient care.
What unique skills do you possess?
Well, my expertise in cardiac surgery and skilled hands are my assets. That has enabled me to obtain the unparalleled results in vein procedures. Also, I have always been commended and praised about my communication skills and bedside manners with the patient, and also my teamwork abilities and leadership. All of them can offer a great service to the patient.
How do you see your role in helping your patients?
What is important is, I think, diagnosis and also offering them the best treatment, conservative or procedure, and performing the best treatment and following them is my main role in treating the patients with venous insufficiency. I want my patients and also the referring physicians to know that I always have and will treat my patients like a member of my family. This is not a cliche. They are someone's father, mother, son, daughter, or spouse, and I will treat them the same way I want me and my family to be treated.